So hello everyone, I am Dr Gaurav Sharma. I am working at Manipal Hospital, Patiala as a part-time orthopedic and spine surgeon. Today we'll be discussing a very interesting case which had presented to us with the knee pain in the left knee, and the knee pain had gradually progressed to such an extent that patient could hardly walk 5 minutes, and interestingly the pain was even present when he was at rest.
I am Dr Sharma, Chief Manager, retired from State Bank of India. I had a pain in my left knee since October 2023. It was minor at that time, but gradually it increased so much that I couldn't walk, stand. I have so many doctors consulted, but everyone told me that it is okay, nothing to worry, and educated me so many times. But the pain still was going on. Then I contacted Dr Gaurav Sharma, who was known to me since long and had a spine operation during 2020. He advised me total knee replacement, otherwise the pain will continue and there is no relief at all. So on 22nd, I got surgery, and today I am quite okay and there is no pain at all. I am thankful to Dr. Gaurav Sharma. Before surgery, I had also consulted a hospital for knee replacement. They done me arthroscopic in my left knee. They said that it will be okay 90% by operation and 10% by rest. But even after 2 months, the pain was continued, no relief at all, and there was no scope at all for me to cope with the pain. Then I again consulted Dr. Gaurav Sharma, and he advised me again to have a surgery of knee replacement, which was got done by him, and it was totally successful, and I am also thankful to Dr. Gaurav Sharma.
So when Mr. Tarsem Sharma came to us, we got his x-rays done in the standing position. And although there was malalignment in his knee, the x-rays didn't have bone-on-bone arthritis. So initially we had given him an injection, but because the pain was persistent and it was quite severe, we went for an MRI. The MRI revealed bone marrow edema, and bone marrow lesions were present on the weight-bearing part of the knee on the medial side, which is the side which was malaligned. So based on that, and because his age is almost 70 years now, I had advised him to go for knee replacement. However, he consulted another doctor in Mohali, who advised him arthroscopy and medial meniscectomy. However, after that medial meniscectomy, he had no relief, and he waited for another 2 months and then came back to us, and then again we offered knee replacement. So after knee replacement, it's been 1 month now and his pain is absolutely gone. So this is a very interesting case because it highlights the importance of getting an MRI done when x-rays are not clearly delineating the cause of pain. And it has been shown that knees, osteoarthritic knees which have bone marrow edema lesions are 2 to 5 times more likely to give more pain than arthritic knees without these lesions. The cause of pain in bone marrow edema is actually an increase in the intraosseous pressure. So typically the patient described this as a tuss kind of pain, which was not relieved even with the painkillers like tramadol, and in fact there was a time he was on 3 tramadols a day. So the message is that whenever we have a older patient who comes with knee pain and the x-rays are not showing bone-on-bone arthritis, it is always a good idea to go for an MRI, because if it shows bone marrow edema lesions and those lesions are on the side of the malalignment, so if it's a varus knee and the lesions are on the medial side and those lesions are on the weight bearing part, then we can be certain that the lesions themselves are cause of the pain. There are various surgical modalities described for these conditions, but given the age of the patient, we decided to go for a total knee replacement to give us single best chance of cure. And as you can see, it has given a good result.
आज मुझे 1 महीना हो गया है सर्जरी कराए हुए, और 1 महीने के बाद मैं इतना कंफर्टेबल महसूस कर रहा हूँ, जबकि मैं एक कदम भी नहीं चल सकता था और हर वक्त हाय हाय करता रहता था। आज मैं बिना किसी सपोर्ट के, बिना किसी तकलीफ़ के और पेन के फ्रीडम से मैं चल सकता हूँ, और मुझे उम्मीद है कि डे बाय डे मैं और इसमें डेवलप कर लूँगा। थैंक यू वेरी मच। यहाँ मैं एक बात और ऐड करना चाहता हूँ डॉक्टर साहब की, डॉक्टर गौरव शर्मा जी की, कि इन 2020 I had a spine problem also. Spine problem was so acute that I couldn't walk at that time. It was totally a corona. It was a totally corona aspect at that time, which was not possible to get operation. But I consulted Dr Gaurav Sharma, and he did my spine surgery, which is now successful, and I am totally cured from that pain also, and also pain from knee. I am very much thankful to Dr Gaurav Sharma as well as Manipal Hospital. Thank you very much.
We are happy to share that Mr. Tansem Sharma, who I had operated previously for L4, L5 spinal stenosis, it's now been 4 years for that surgery, and now with his knee, he's a happy patient of ours, and he continues to spread positivity. I am available at Manipal Hospital, Patiala every Wednesday from 10 a.m. to 2 p.m. And for consultation, you can consult at the numbers given below.